let's get started. Okay, so the first slide is a mindfully centered approach diagram. So this entire approach was developed in the past 5 years, and the foundation of this approach is channels. So channels in Chinese medicine, we talk about 14 channels. So yesterday's talk, we focus on what those 14 channels are and their effect on the body and stuff like that. But if we just review this diagram a little bit, so channels is reflect everything that we experience, both the present time and maybe the past time as well. So let's say if I have trauma and I was abused as a child, my channel actually runs a certain ways. If I'm very worried about something, my channel runs a very, very specific way. Today in the clinic, I actually have a client, and she lay down. Last time I saw her, her channels were running really, really bright. Um, Today was just very, very, very sluggish, almost not moving very well. Then I scan and I look at her and I ask her, it's like, do you have something in mind that you have trouble solving? Um, and she said, absolutely, yeah. How can you tell? I said, well, channels always tell the truth. And indeed, she was trying to resolve some long-standing issues with her mom, and she was having a problem with that. Um, and we talk about it, and she find the most empowering thing to do at this moment. Um, and her channels went back to normal. So it's channels are really reflection of our thinking process, our emotions, our physical being, and our connection to loving kindness. So in this diagram, there are a few boxes on the bottom right side. It's a physical, so that's the subject we'll be talking about today. On top of that, it's emotional, so that's we'll be talking about emotions tomorrow. And then perspective on the left hand side, sympathy, empathy, compassion. That'll be the fourth day, and then we'll be talking about purpose and connection to loving kindness. And if you notice that all these boxes have bidirectional arrows back to channels. So essentially, any physical, for example, any physical issues will affect our channels, and you can go ahead, go forward and affect, for example, our emotions. And I think this is how we feel, right? If I have emotional pain, it affects my channel, and eventually it may affect our physical body. Um, and lots of times, I find suppressed emotions over time just creates a lot of problem. For example, it may cause tumor, may cause even cancer. Um, so, okay, so this is the first page. So every time we're going to show this, and to me, this is how I approach in the clinic, and this is how I live my life as well. Um, So the goal is for me to live a life that's no different than how I treat my patients. So that's really my goal, right? So my cultivation is to say, I want my channels to run well, and ultimately, I really want to be, for example, like a loving kindness lighthouse. That's how I want to be. Um, and in order to achieve that, I have to manage and I have to really make sure that my channels run well. And I really have to take care of my physical being, my emotional, my perspective, and my connection to loving kindness. So, so it's not just focusing on one aspect of my being. It's really looking at all aspects of what I can do to be the best of myself. So um, so this page, this diagram looks simple. It really took me 5 years to come up with it and refine it and really experiment it in the clinic. And today I use this to treat um, very, very severe issues: PTSD, depression, anxiety, cancer, autoimmune issues, and the whole thing. Okay. So for cancer patients, for example, I will, basically based on this diagram, say, well, you're not going to try to survive. You're going to start to thrive. Your channel is going to reflect how you feel. Okay. And this is something we can do, anytime, with any illness, as long as we have a breath and the conscious, we can do this. Okay, and this is basically the whole purpose of this 7 talk series, is to um, not just to find way to heal physically or emotionally, but to truly heal. So healing, my definition of healing is our connection to loving kindness, and that's it. Okay, because I tried many other definitions, and I find a lot of holes in them. For example, if the definition of healing is to have a very good physical being, eventually it's going to fail, because eventually we're all going to die. Um, so the only way I can find, and to really keep myself feeling optimistic and hopeful and upright, and always have something that I feel empowering to do, is really just my connection to loving kindness. I have a heart of gold, and through this, um, a sense that I have a purpose, that I connect to loving kindness, and that's how I want to be on my very last breath. And I have one patient who passed away this way, and my dad passed away in my arms this way as well. So when we pass away in that state, there's really just peace, which is really awesome. Okay, so let's move forward. So the second slide talks about physical issues. Okay. So the number one physical issues that I see in the clinic are scars. Okay, scars due to surgery, injury, accident, C-section, knee replacement, hip replacement, um, surgery of any kind, gallbladder removal, heart surgery, cancer surgeries, and stuff like that. Self-cut is actually a big issue. Self-cutting induce. So yesterday we talked about the 4 modes of our channels, and one of the modes is dissociation. So self-cut essentially triggered our channels to go into dissociation. So let's say if I have just severe emotional pain, and I couldn't stand it in my body. Uh, quite a few people go that direction and basically, find a razor and just start cutting themselves. And once they do that, and there's, a little bit, the skin is perforated, and the little drops of blood come out, they actually go into a different state. In that state, they're out of their body. Many people can do this, as if they're looking at their body from their outside. Um, and in that state, they really feel no pain. It's a great relief. And I think drugs probably do that to a certain degree. I don't really have all these experiences, but that's what my patients explain to me. Burns is a big deal. Any kind of burns actually cause severe channel blockages, so that needs to get taken care of. Stepping on nails or glass, again, very. I have one patient. She's about 55, I would say 55 when she saw me, and she had exhibiting Parkinson like symptoms, and she was diagnosed by one doctor. She saw three doctors who were qualified to diagnose Parkinson, and one of them diagnosed her with Parkinson. The other two said no. So when she came to see me, I asked a few questions. So she had tremors and some rigidity in her bodies and stuff like that. Uh, so when I asked her questions, one question that I find very interesting was she started having migraine uh, on right side of her, temporal, when she was about 10 years old. Okay, 9 or 10 years old. Okay, and then she couldn't, and for a while, we couldn't figure out why. And because in the clinic, I literally go over the entire body with my hands. So when I was pressing the bottom of her foot on her right foot, right in between the fourth and fifth toes, she screamed, in pain. She screamed in pain and said, "Oh, I stepped on a nail when I was 8." So that was 2 years before her migraine starts. And from that, we basically unlock and uncover, and her Parkinson symptoms pretty much all go away within a few sessions. Um, so what happened was when a young child, around the age of 8, step on a nail, it still has to go through what she has to do. So a lot of times we just dissociate from that injury. Okay, as if the brain has no, it's like in the brain, in our brains, like we have a very very detailed Google map of every part of our body. Dissociation essentially remove a certain map from the brain. In this case, the connection to the injury site. Okay? And because of that, the channels that's supposed to go there, the nutrients that's supposed to go there, everything that's supposed to nourish our body, doesn't know where to go. And and then our channel, because the little toe area associated with our what we call the gallbladder channel, which goes from the side of our head all the way down to our side, go through the IT band all the way down to the little toe. So the gallbladder channel was blocked, and subsequently she had, migraines. Cuts on the head, very very critical. Okay? So I've treated people who, one guy, his brother was actually throwing a brick onto his head and has a huge cut. Um, you know, Playground accidents, or any kind of cuts on the head, okay, or on the forehead area, on the face, to me are very, very critical in terms of channel flow and one person's emotional state. Animal bites, okay, this is huge. Okay, animal bites. Imagine an 8-year-old, a 7-year-old kid, walking on the street and get attacked by a dog, for example. Okay? It's life and death, life and death. Okay? I've treated quite a few PTSD cases just because of animal bites. One lady, she was sitting at home. The boyfriend's um, dog, very friendly dog, golden retriever actually, was eating. And she just happened to go too close, I guess, and the dog attacked her, bite her on the face. And she had PTSD for 3 months until, we resolved that. So animal bites, big deal, big deal. Anytime there's barking and we see canine teeth and, our skin and flesh was punctured, perforated and punctured, it triggers this life and death fear. Very, very dramatic. Okay. Skin anomalies. It can be moles, can be birthmarks, skin tags, unhealed wounds, vaccine spots. Actually, I've seen this quite a few times that affect our channel flow. Okay. Trauma again cause pause and dissociation. For example, animal bites that would be considered trauma. Um, so accidents, broken bones, toes, fingers, assaults of any kind, especially sexual assaults. Under severe restraint. Okay. Concussion, stroke cause severe pause condition in the head, and dissociation as well. So we treat all these in the clinic. And people with concussion, normally they are, they know they're different, but they don't know why they're different. Okay. So it's just, concussion is just like any parts of the body, right? So let's say if I break my ankle, then automatically I dissociate from the ankle. Okay, why? Because otherwise I'll pass out. If I'm hiking on the hill and my ankle, I roll my ankle severely, or even if I break my ankle, um, and it's getting dark and it's getting cold, I have to dissociate from my ankle to get down the hill and to find help. Yeah. So concussion is no different. It's just parts of our brain is under attack, right? It's under very severe trauma. So then automatically there might be a disconnection, dissociation. Um, so all the MRI machines, all the X-rays, and everything else will say the person is okay, right? But um, there's something in there, and the person knows it's not quite right. Jewelries. Okay, this is actually interesting. When I brought this up, many people are in disbelief. And in my clinic, I actually have a glass jar, and that has toe rings, tongue rings, and navel rings, and you name it. Okay, bangles and stuff like that. That's all of my patients. And they say, what do I do with this? I say, well, give it to somebody you don't like. And they say, I can't do that. And I said, I was just kidding. If you don't want it, I'll keep it. Okay. So I literally have a glass jar that's kind of quarter full of these things. Jade bracelet. Chinese ladies are. So I actually have a classmate in Chinese medicine school. She's Caucasian. She went to China, and they were walking the night market, and out of nowhere, a vendor just basically took her hand and just shove a jade bracelet into her left arm, and she couldn't get it out, for 3 years. Um, and finally, I told her, it's like, you got to break this. Okay, so jade bracelet. Okay, um, the traditional belief is jade bracelet is going to protect that person, okay? Spiritually, physically, emotionally, you name it. Okay, there's lots and lots of stories about that. But in reality, the person who wears that bracelet is going to try to protect that jade, because you don't want to hit it, you don't want to break it, you don't want to do things with it, right? So what happens is there's a tension on the shoulder, on the elbow, and on the wrist to try to get this bracelet as close to the body as possible. So over time, and my mom had that for about 30 years, and I tried to convince her to take that off for like another 10 years, and causing frozen shoulders, severe problems. Um, so especially the ones that you can't take off. Boy, that's yeah, I highly advise to take that off. Okay, even if a hammer is involved. Piercing, piercing. The piercing issues I've seen are more like a tongue piercing or navel piercing. Um, I feel like the nipple piercing or even more dramatic piercing will have huge effect on the body as well, channel wise. Okay. Um, and once it's taken out, like nose piercing, stuff like that, because it's just caused the body irritation, right? It caused something. So take it off if that would be my recommendation. Okay. Toe rings are horrible. Okay, finger rings are probably okay, but toe rings are just bad. Okay, our feet take so much, it carries so much weight. The toe rings I've seen are, they all messed up, people's toes. Okay, and we really take that off. People who come into my clinic, they have any condition. I look at toe ring and it's already deforming the toe. We just say, we got to take this out. Okay. And I probably have like 10 toe rings in my glass jar. The finger rings, okay, if it's a wedding ring, it's a single ring, it's probably okay. But if it's a double ring, okay, many people have like an engagement ring and a real wedding ring. An engagement ring may be gold, and the wedding ring may be like white gold or something. It's a different color. Okay, so essentially we're talking two kinds of metal. Two kinds of metal creates a current. Okay, that's how car battery works. Okay, two different metals create current. Our channels are currents, are electrical currents. So it really interfere with things. Bangles, okay. I've seen like ankle bracelet that cause huge problem for a person emotionally. I had a patient with an anger issue, and she wore a silver or some kind of a silver ankle bracelet. And I asked her to take it off. Her channels runs better. She put it back on. Her stomach channel doesn't go down, and she automatically just feel like, yeah, John, I do feel more anger, when I put this on, right? Um, and of course, she actually had very, very severe childhood trauma, so that might be a very highly contributing factor. So The bottom line is this: okay, if we're a normal person and we are filled with love, and we have no issue connecting to loving kindness and connect to other people, I would say jewelry is probably not a concern, right? But if in our lives there were trauma, there were emotional pain, there were other issues that that we're dealing with on a daily basis, and we're hyper vigilant, um, and our world is not quite safe, right? All these jewelries start to play a better, a more strong role in getting us a good channel flow. Diet, okay, um, diet is really a big thing, and I'm really hesitant to talk to people about diet for some reason because I really feel it's people's choice. Okay, and I respect people, and I feel like my job there is really to empower my clients and not to tell them what to do. So often, basically, I just point them to some documentaries or some studies and stuff like that. But in reality, okay, in the clinic, this is what I see on a daily basis: is diet affects circulation. Okay, it causes extra levels of, for example, if a meat rich or fat rich diet, it increases the toxin in the body, in the blood. The liver has to work harder, the kidney has to work harder, the entire blood circulation has to work harder, the heart has to work harder, the blood pressure has to be higher. Okay? Um, and it accumulates what we call dampness in the body. Okay? Dampness is basically a Chinese medicine. I think the Chinese medicine, the best invention of Chinese medicine is this term called dampness. Okay? Our body is 70% water, and dampness is essentially water or fluid in unwanted or unnecessary places. Okay, so in Chinese medicine, dampness actually includes fat, okay, fat cells, okay, adipose tissues. So what dampness does is it slows things down. Okay, it's like a river that's just full of junk, right? And the water just doesn't flow smoothly. It's like a swamp. So a swamp can get extremely, just humid and heated up, and just, or it can get really, really cold. Okay, but the bottom line is it slows things down. Okay, your body is supposed to run, all the blood flows and um, circulations and everything else is supposed to run at a certain rate. Okay, and dampness just slows everything down. Okay, cause channel issues. So what I see is the dampness really cause, can potentially, and again, I can't say for sure, right? Because who can prove this? But there's huge potential to create tumor, heart issues, and diabetes. The next thing is no milk. Okay, milk, it's proven over again. Okay, it's just pure mucus, and mucus causes dampness. Um, and this great myth that the milk does the body good, right? And the milk give us calcium, right? And give us strong bones, right? We can look it up. Okay, U.S. Is the number one milk consumption country in the world, probably. Right? If you look at the bone density of the older population, you will be able to see it. Okay, but the ill effects of milk is mucus. Um, so my recommendation is switch to more plant-based milk, almond milk, coconut milk, stuff like that. The key is not to have too much sugar added. Okay. Some of the almond milk, especially oat milk, could be extra sweet. And if you have if you drink that, dilute it with equal parts of water. That's probably good enough. And personally, I am on whole food plant-based diet for the past 7 years. Um, and I would recommend highly that anybody can try this. If we can do a good percentage of whole food plant-based, that's good for our body, for sure. Yeah. And I want to share a story of one of my patient. Okay, she's 95. she's being addicted to cheese. She'll go to Costco, buy these huge chunk of cheese and buy multiple of them, multiple flavors, and she will have 2 to 3 servings every day for at least 3 or 4 decades. So one time I was needling her and I hit a vein, and when I take the needle out, a drop of blood came out. And I turn around, grab a cotton ball and to soak up the blood. And when I do that, I couldn't soak up the blood. Okay, within less than 5 seconds, that blood is basically solid. It looks exactly like a little drop of cheese. So I look at it and I talk to her and her daughter who consume cheese with her, you know, 3 servings a day for the past however many years. And I said, you got to change this. And she, both of them said, John, can we stop once we finish everything in the fridge? And I said, no. You go home, you grab your dumpster, and you just dump them. Okay, dump all the cheese in the dumpster. Okay, in the garbage bin. And they actually did it that night. And 2 weeks later, I was doing the same thing. Needling her, and a drop of blood came out, and it was beautiful. There were like 4 or 5 people in the room in the clinic at that time. I literally scream in delight and say, "Yeah, come, everybody, come here and take a look at this drop of blood." It was so clear, so sparkling, like it's like a morning dew. It was just beautiful. Okay, so in 2 weeks, by stopping eating the same thing she's been consuming for 40 years, she literally changed her whole entire system. Her swelling on the feet, the edema on her feet dramatically reduced. The coloring was so much better. Her blood pressure, her her sugar level, blood sugar level, all improved dramatically. So um, food is really our medicine. Yeah. Okay. Next slide. So I look at the feet and I look at the posture. Okay? To me, these are two key things that anyone can change, anyone can do, as long as we are a bit more mindful. So posture issues and toe issues and ankle issues essentially creates what I call baseline stress. Okay? So if we don't stand correctly, like the lady on the right hand side, with the slouched shoulders and the head forward. Okay. So this very, very simple posture here, which is quite common, and essentially there are several problems, and let me list them. First of all is, the breathing will be shallow, and will not be very, very deep, won't be complete. She's going to develop, she's going to have chest pain around her chest area, around her breast area. Okay. She's going to have some neck strain, shoulder pain, and back pain. And because her head is forward, she's going to put extra load on her knees. So eventually she's going to have knee issue. And with knee issues, she'll probably start to develop other toe issues as well. Okay. Her digestion would not be so good because the shallow breathing basically restrict the rise and fall of her abdominal cavity, which facilitates all the digestion and elimination and circulation and blood circulation as well. Okay, so just from this one posture, we're talking, a whole set of potential causes for you name it, insomnia, sleeping issues, and just couldn't wake up, and dampness, and you name it. Okay, so this is one thing that we can all work on. Okay, and I guarantee everybody, if we start working on this today, um, you will see results within weeks, and within month you will be all good. Okay, this is very doable, and it's something that we gotta do if we care about our body. Toes are Toes are a good indication of several things. If we have Morton's toe, which means the second toe is longer than the big toe, the first time we put on shoes, we're restrained. Okay, um, and people in that condition normally are anxious because it's really uncomfortable. And if we just kind of crunch our toes together for like 10 seconds, we'll feel we'll automatically feel more anxious. We'll get into what we call the fight and flight mode. So we will be more anxious. Right? So people with the second toe that's longer than the first toe, than the big toe, normally they eventually that the second toe start to have problems. I've seen many hammer toes, and it's because they're so used to wear shoes in the house. Okay, wearing shoes is considered as being polite, as the proper etiquette, right? At least many years ago. Hopefully that doesn't exist nowadays, since flip flops are so commonplace. So yeah, very very important. And bunions, which is the opening of the extra growth on the base of the big toe. Okay, um, that's actually to me, I've seen that quite often. So I actually do, could be a rolled ankle that hasn't been healed, or a slightly rotated or off pelvis. Okay, that caused the walking to be kind of funny. And over time, we put extra load on underneath the big toe, and the big toe, the base of the big toe, just has extra growth. Okay, so all these can be changed if we're mindful again. Okay, so ankles are so important. Most of us roll our ankles. We just, it's just like when it's no pain, we just continue to walk. Okay. Um, so make sure it's truly healed. And the way I would suggest, to do it ourselves is, basically just rotate our ankles and see how it feels. Okay, if it clicks, and if we rotate it and traction it a little bit, pull it out of the socket a little bit using a little bit of force and see how it feels. If it feels dramatic pain, the ankle is still not healing. Um, um, and there are ways to self-help, but if it's needed, go see somebody who are really good at their hands. Okay, the next slide. So this is what I've seen: localized channel blockage over time, over years, and stuff like that. They can create the following symptoms: okay. Depression, anxiety, cancer and tumor, hormonal imbalances, asthma, COPD, digestion issues, elimination issues, autoimmune problems, sleep problems, migraine or headaches, dementia, myasthenia gravis, Parkinson's disease, and violent behaviors. Okay. Um, some violent behaviors, especially like somebody who's very nice. I have this friend, yeah, a very good friend actually. Um, he was using a bar, like a tire bar, trying to to do something with the tire, and the bar kind of rebounded onto his in between his eyebrows when he was 16 years old. And ever since then, he's violent when he gets angry. Okay. Eventually, he joined the Marine, and he wasn't really big and wasn't very strong. And Marine seems to have this tradition, like people can fight individually, and other people will just cheer on. And he was really, really, really good at it. You know, and it's not because he's the strongest or most skilled, and it's because he has no pain when he's gets agitated, because the scar that he has, he just gets into this very very violent mode where he would just have to finish that person. Very very interesting, right? Um, so that scar was needled. Okay, that channel was rebuilt, and it's going well. So I think these outbursts of violent behaviors has stopped. Yeah. So what we do in the clinic is in terms of healing and treatment is if it's scars, we do needling. Um, it's it doesn't the scar needling is actually not necessary for channels to go well. I've tried this so many times with my patients, and we can try it right now. Is if we're mindful of our perineum, okay, perineum is between our anus and our genital. If we're mindful of it and pull it up ever so slightly, as gently as we can, so we're in our body. In our heart, we have the sense that I have a purpose. I don't know what my purpose is, but I know I have a purpose. I may be the smallest blade of grass among giant sequoia trees, but I have a purpose just like they have a purpose. So in my heart, in our heart, I have a purpose. And from our third eye, which is in between our eyebrows, we connect to loving kindness. Whatever loving kindness means to you, could be God's love, Jesus' love, Buddha's compassion, our most loyal dog who show us unconditional love. Anything that represents unconditional love. So again, perineum, I have a purpose in my heart, in our hearts, and we connect to loving kindness. When we do this, all our channels go well. Very few people's channel are blocked when they were able to do this. So why am I still doing needling and doing adjustments and everything like that? Okay. So when we do this mindfully, we're good. We could be laying on the deathbed and we're like 3 breaths away. Okay, we can do this, and our channels will go how it's supposed to go. But unfortunately, in normal daily lives, we're not as mindful. So if we're focused on other things and we have scars, then our channels naturally wouldn't flow very well. Okay, that's why we in the clinic we treat scars. Okay, and to treat scars, ideally we use needles. We have other methods, but it's not as effective as acupuncture needles. So in the clinic, we do, a big time, we spend a lot of time restoring postures, make sure a person's posture is as aligned as possible. And to, to really reteach or retrain a person to stand, walk, and sit properly. Okay, this sounds ridiculous, right? But 10 years ago, I started learning martial art, Wing Chun martial art. And for 3 years, I was basically I go there and practice and get hit every night until finally I know I couldn't walk. I don't know how to. I don't know how to stand. I don't know how to walk. I don't know how to move. Then I literally recalibrate my entire posture, my entire way of walking, sitting, and moving. Okay. I had a motorcycle accident when I was 15, so my cervical spine, my neck was my neck spine was reversed. So I have very, very severe arthritis on my neck, and I have daily headaches until I realign my posture, and now I can do a lot of things without pain. Yeah. So today, honestly, everything I share are my firsthand experience. Okay, I don't share things that I learned from books or heard somewhere else. These are all my firsthand experience. So in the clinic, we definitely resolve pause and dissociation conditions, the channel conditions due to trauma. So that involves, that includes PTSD and violent traumas, abusive childhood, and all that. And we do recommend a more whole food, plant-based, rich diet. And exercise and stretching until 90. Okay, what does this mean? This means do things. Okay, do the exercise, do the stretching, do whatever you do, as if you can continue to do this until you're 90 years old. Okay, so if you're doing Olympic weightlifting, consider if you can do this when you're 90. If we're doing triathlon, consider it if you can do this as 90. Okay, and if not, figure out a plan to gradually shift gear so we're maintaining our fitness, maintaining our health, rather than keeping up certain performances. Okay? Because the ultimate goal is to stay well. Okay, it's not to continue to perform or compete. And abdominal breathing. Okay, this is really a key. And I think, okay, there's one more slide, and I'll talk about abdominal breathing. Okay, so this slide is has a few pictures. This is our what we do in the clinic to do posture alignment. So the first thing is there are 6 points underneath our feet. The 2 points underneath the big toe and the little toe, and there's 1 point a little bit front of the heel. Okay, it's not at the center of the heel, but a little bit towards the toe side. Okay, so when we stand, we equally distribute all our body weight along those 6 points. Okay, most people when they stand, most of the people that I see in the clinic when they first came in, they're more leaning towards the 2 front points. So they front load, they load their 2 front points more. And what happens is their knees have extra weight, and because of that, their back has to be tight because they're not balanced. Okay? So anybody can try this at home. Okay, first know these 6 points, and then rock forward a little bit and feel our body tension. Go rock back to the center and feel the body tension and rock back a little bit. Okay, and we do this 3 times. I guarantee you'll find a position where you're most relaxed based on your current posture. Okay, your posture may not be ideal. Head may be forward and shoulder may be slouched a little bit, but it doesn't matter. There is a position where you feel the most comfortable. And if you can choose that position and stick to that position for a while, your body will start to change. What happens is when people are stressed, we tend to find a position where every part of our body is basically tight, but we don't notice it. And then that's the baseline stress. Okay? That's the stress that's causing long-term issues. So what we do is, focus on these 6 points when we stand, and when we sit, we still put those 6 points on the floor. And then, but in terms of weight carrying, we start to focus on the 2 sit bones. Okay, so we evenly distribute our body weight along the 2 sit bones that's making contact with the chair. And when we sit, when we stand, our knees needs to be unlocked. So this is opposite to knees locked. So the best way to describe this is to first lock our knees, and then just move a tiny little bit until the knee is unlocked, and that's it. Okay, that's the position we want to be. Okay, not like bending down to unlock our knee. No, it's just as soon as the knee is unlocked, from the locked position, that's the position we want. That's the position we want. Another concept we do is called a bucket. Okay, so the perineum is the bottom of the bucket, and the whole pelvis and our whole entire core area, is the rest of the bucket. So the whole idea is, we move with our bucket, okay? Not with our, not with the pelvis and the core disconnected. So we move with the core and the pelvis as if it's a one unit. Okay. When that is done, we're solid, and our entire chest and our shoulders and head can just relax and just situated on this beautiful bucket. Okay, and that's it. Okay, that's how we can achieve a very relaxed and very good posture. Okay, so what I would suggest is, every day when we brush our teeth, look at ourselves in the mirror, eyes level, and just feel our 6 points, unlock our knees, okay, get our bucket right, and just feel how relaxed our upper body can situate it on this bucket. And then start brushing our teeth. So every day do this twice, and mindfully just feel our entire body, see how relaxed it can be. And I guarantee you, over time, this will become your go-to, posture. You don't even have to think about it. Okay. So the last thing I want to talk about is abdominal breathing. Okay, abdominal breathing uses our diaphragm, so it's a diaphragm breathing. So the way to do this is, I would suggest laying down, face up, put our hands on our abdominal area, underneath our uh, belly button, and then allow the diaphragm to go down. Okay, so this will rise. This will arise our stomach, so our hands will get pushed up. So the abdominal pressure will increase. Okay, continue to allow the diaphragm to go down. So the stomach, abdominal cavity, the pressure will continue to increase until it will actually expand our floating ribs in the abdominal cavity. If we continue to do that, the expanded floating ribs will continue to expand the rest of the ribs until our first rib. Okay. Our lung is actually connected to the diaphragm and to all parts of our chest wall. So when the diaphragm goes down and the chest wall expands 360 degrees in all directions, our lungs are fully open, as as if it's an accordion. So when this opening creates negative pressure within the lungs and allow the air to naturally flow in. Okay, so we can breathe effortlessly. In the reverse, the chest wall kind of go back to its normal shape, right? And the diaphragm goes back up, and that's exhale. Okay. So with this, and I would highly recommend, like when we go to bed before we fall asleep, we just do this, 5 times, 7 times, 10 times, however many times we can do. In the beginning, we're gonna feel like, oh my goodness, my I just feel very dizzy, when I do this because we're not, the diaphragm wasn't strong enough to push down and really open up the accordion, which is our lung, right, to get the air in. So that's very natural. So we're a little bit oxygen deprived, and that's fine. Okay, and if we feel that, just go back to the normal way of breathing and get some oxygen back in. So the diaphragm, in my mind, is the number one muscle we need to train our body. Okay, it's hard to train any parts of our organs, but the diaphragm is definitely we can do. And when we do that, we increase. Essentially, we're causing the abdominal cavity to have pressure and no pressure, no pressure and no pressure. When we do this like 20,000 times a day, this helps our entire system to function, at its optimum state. Our digestion, our elimination, our circulation, um, all these detoxing functions and the hormone generation of our gut is actually the number one immune and hormone generators in our entire body. Okay. um, and also all the functions, our sexual functions, our um, all will improve because of circulation and because the flexibility of all the innards, okay, all the intestines and all the organs within our abdominal cavity needs to be free flowing. If we put our hands down, if we just, they need to be able to move apart. Okay. If our abdominal doesn't have all these pressure and pressuring and depressuring activity, then it's very easy for the intestines and all the organs to get sticked, to be adhering to adjacent membranes and causing adhesion problems. Okay, so this is very very important. Okay, to breathe with our diaphragm. Okay, so it's 6:50. So this is my entire presentation, and this is the physical aspect of the mindfully centered approach. So right now I'm going to open up the mic. Anyone who have questions on the Zoom side, you're welcome to use the chat window, and I will respond. Yeah, so please raise your hand. I'll bring you up, and let's continue to share. Thank you.
Hey, John.
Yes.
Yeah, thank you for sharing the physical aspect of the healing. Can you share more about the detail about how to walk?
Yes.
Thank you.
Thanks. So, sounds interesting, huh? Who can walk, right? Um, so the recommended walking. Thank you, Fengling, for the question. Okay. So the recommended way to walk is like this. So first we stand with 6 points evenly distributed, and then we start to move our perineum parallel to the ground, as if we're on a train track. So we can move the perineum, essentially our entire bucket forward, okay, parallel to the ground without. So once we can move that a couple inches, basically, okay, maybe 1/2 inches without issue. So once we move, then our leg start to move, okay, and the leg moves because we have to keep our balance. So in the clinic, what we do is I will literally push a person, push a person's bucket and say, well, you just stand and I'll push you. By the time you feel like you're off balance, you start to move. And when we walk, ideally we land on the heel point, okay, the point that's in front of the heel a little bit. We land on the heel point, even though that point can never touch the ground, we feel like as if we're doing that, followed by the two front points simultaneously. And this is how I suggest that we walk. Okay, this is how I do martial art, um, because this way I can move without basically I can move my body first, and I feel like a lot of the tennis players, especially Roger Federer, that's how he moves. He moves his body first, and then and then his legs forward, follows along and stuff like that. This is very different than doing a 100-meter race where the power mostly comes from the muscle of the legs and the feet pushing the ground. So this way we'll be walking as if we're on a train track. So the same thing when we walk uphill is we our bucket just move parallel to the heel. Okay, so this is a very different way of walking. And Feng, thanks for asking this. I know we've been practicing this for a while, and many people who have knee issues, knee trouble, um, really benefit from this. 10 years ago, I couldn't walk up and down stairs, so today I can. There's no issue with my knees, and I think this really make a huge difference for my well-being.
Yes, I think it's very different because what we were taught since we were little, that we are taught to raise our feet or foot at one at a time to start walking instead of move your body first and then the legs and feet will follow. So it's very different. And the first time I practiced, I felt that my steps actually lighter and it's more effortless to walk for a longer time. So yeah, I think this is a really good way to keep walking. Yeah.
Yeah, thank you. Yeah, especially I have patients who are very diligent. Okay, and I have every time I say the word diligent, I think of my mom. Okay, she my dad and my mom are very diligent. Um, so they will go to the 24-hour fitness center. Um, before they were like 70, I think. They will go there for almost 20 years nonstop. Okay, the 24 fitness center only closes on Christmas, and that's the only day they miss. So they will go there. My mom will get on the the walking machine. Okay, and she will walk for like 2 miles with certain slope. Um, and she had both of her knees replaced because of that, because she wasn't walking properly, because she was basically pounding the stair machine. You know, so being diligent, is a virtue. But when it comes to body health, we have to listen to our body. The knee is such a strong joint. By the time it's hurting, we have worn out quite a bit of the knee cartilage. So being able to walk without loading the knee and putting stress on the knees are very, very important. Okay. Again, I recommend anybody to try this. And if you try this today or tomorrow morning or something like that, and tomorrow night, tomorrow at 6 p.m. Um, Pacific Daylight Time. Um, I'm in California. Let me know. Let me know how you feel. Okay. And my daughters, they walk to school like a mile or something like that. And once I, with a very heavy backpack full of books, and once I told them, can you try walking this way? They came home. They were like, Dad, this is crazy. We're literally flying to school. That's how they felt. Okay. Um, and when we walk this way, we have a really, really beautiful posture. Really, really nice posture. Yeah, something to try. Okay, everything I said um, are experiential. Okay, we just gotta experience it. Try that 6 points and try the breathing exercise. To get our body better, we have to be the first doctor. We have to be the person that truly experience and feel and mindful of how our body performs. Otherwise we're giving way too much power and authority to so-called doctors. Yeah. Thanks. Oh, I forgot to put on my earphone for Zoom. Anybody trying to talk to me, or now I put my earphone, now I can hear the Zoom people. Any question?
Or anybody have any physical issue, welcome to raise your hand and come up to chat. We have a question on chat window.
Oh yeah, okay, good. If we experience knee strain at times, but it recovers, does it mean our cartilage is worn out or not? What can we do to help maintain our cartilage? Great question. Um, so the knee pain may come and go. Okay, does it mean the cartilage is worn or not? Okay, I would say the cartilage is worn to a certain degree. And why is it in and out, right? Uh, it also has something to do with our muscle tension. Okay, so we have quad muscles attached to the shin bones and stuff like that across. So we have muscles across the the knee joint. So when these muscles are tight or when these muscles are looser, okay, the knee feels differently. Also, our body adjusts itself. Okay, so we actually find the best position we can be in to avoid pain. Okay, but eventually, if this condition continues, then it's going to cause problem. So the best way to help maintain our cartilage, in my mind, is the way the bucket walking, basically, or the perineum walking that I just described. Okay, because when we do that, we're not loading anything in our knees, which is very, very interesting. Um, we can actually try very deep squats. If you go to my Instagram account, so in Clubhouse, you can just look at my bio, and I'm gonna type my Instagram account on the Zoom side. So my Instagram, it's mindfully.center. So I have a video of very, very deep squats that I do against the wall. It's not an easy thing to do, but it's doable. Okay. Again, 10 years ago, I couldn't walk up and down stairs, and today I have no issue with my knee whatsoever. Okay. So can the cartilage regenerate? I will, from my experience, absolutely. And how can we regenerate it? By not loading the knees, by giving the knee a chance to regrow, by giving it, by stop basically grinding our knees, right? Grinding our knees cartilages and allow it a chance to grow back. So I think that's what I did in the past few years. Thanks for the question. Okay, great. Let me talk about arthritis. Okay. So arthritis is a physical pain, and arthritis trigger fingers and basically fingers having issues, not very, very mobile, or we can't really open up the palm very well. Okay, or if we open up the palm and put it on a table, can we put our palm entirely flat on the table? Okay, so all these are very, very important questions. To me, the thumb especially, when it couldn't open up, then there's something, then it's the living becomes harder. Okay. So the way we do this is to just use a regular dowel basically, or a little stick, the round stick, okay, about the you know the diameter of our index finger, for example, maybe about 12 inches or 20 centimeters, and we basically just roll our hands. Okay, just grab a stick and just roll. Okay. And then gradually find pain spots, along the side, the bottom side of our thumb, or on the side of our little fingers, and basically just roll this. Okay. And what it does is start to increase circulation and increase movements. And once we start doing this, we can actually roll our hands, roll the stick, in our hands, with our elbows, okay, with our shoulders, or with our kidneys, or with our pelvis. Basically we can start to move the entire body to generate that motion. And I did this for a 90, at that time I think she was 93 or maybe 92, the previous Summer Olympics. This lady, in her 90s, basically came with both trigger fingers on her middle fingers, and she was actually told to have surgery, but because of her age, they were considering. So I look at that, and she said, "John, I have this trigger fingers, and I also have, arthritis pain on both of my hands, on all finger joints." Okay. So I look at her, and I ask her, "It's like, do you watch the Olympic?" And she said, "Yeah, of course, every day. It's really good." And da da. And so I gave her two sticks. Okay. I said, every time you watch the Olympic, you use this stick one at a time. Okay, because just make sure you have more than one stick, so that you're always available. And just use the stick on your hands. Okay, and just roll and roll and roll. So every time you watch Olympic, this is what you do. Okay, and she did it. Okay, by the time the Olympic is over, she has no issue whatsoever on her hands. no arthritis, no trigger fingers. Today she's 95, 96. There's no issue with her hands. Okay, so these things are, to me, they're very reversible. Okay, um, if we start moving. Okay, all this is about circulation, about blood, um, about channels, right? When the channels goes to the fingers. So and my mom, let me tell you one more story about my mom. So my mom had bunions on her toes, okay, on her big toes. Right? So the bunions are extra bone growth on the big toe, right, because of her pelvis and posture and everything else. Um, I think this probably 30 years ago. I can't remember the exact time. Her left and right toes have the same severity of the bunions. She went to Kaiser, and the doctor talked to her, and they decided to operate on one first because then she can still move around. So they operate on the right toe, right big toe, and it was a complete failure in terms of the operation. Today, her right big toe is resting on her right second toe. Okay, it doesn't touch the ground at all. But miraculously, within 2 years, her left bunion was completely gone. Today, she has no bunion issue whatsoever on her left foot. So for some bizarre reason, the operation failed on her right toe and it healed her left. So in reality, what happened was because of that botched operation, she changed how she walked. And the pressure was, let go of her left big toe. And the bone just started to go back to normal. Okay. So many people ask me, it's like, John, can I fix this bunion? I say, absolutely. If you change how you stand, how you walk, how you put pressure on your toes, and everything, the body knows what to do. The body wouldn't waste, a single bit of resource on building bones that's not necessary. Bunions were necessary for how people walk. Until they change how they walk, then the bunion stops and it starts to reverse itself because the extra bone on the excuse me because the extra bone on the big toe are not necessary now. Yeah. Okay, I got one more question. Bucking our daily life, such as lifting heavy things for people who walk. Okay, so here's the question from the Zoom side. John, could you share more about how to use our bucket in our daily life, such as lifting heavy things, and for people who walk with a cane or walker, how do they balance? Thanks. Okay. Um, so to use the bucket in our daily lives, like lifting heavy things, right? So lifting heavy things, we definitely want to use our legs, right? So the bucket is for stabilization. And the bucket actually, when we squat, right? When we use our legs, when we squat down, the bucket actually has two more points that we can look at. Okay, we can feel, and these are our sit bones. If we do a deep squat, okay, if we squat down, we can imagine that our hip bones, our sit bones are actually spreading out to either side, okay, very, very slightly. And when we come back up, we can feel like our sit bones are actually squeezing back together, okay. So we're literally using the pelvic power or this bucket power to do the squatting down and this, and the standing back up. Okay, so that's one way to do it. For people who walk with a cane or a walker, or if they're kind of weak, what I would suggest is actually um, just grab two chairs, for example, okay, with kind of a with backs, right? So our hands can put there, and we can still have openness in the front. in our back, right? Then I would just suggest that they just lift their leg. Okay, they will push down. They will move their bucket and move their leg, and they move back and move their leg. Just simple things like this to get the mechanics down. If they do walk with a cane or they have trouble walking, then we actually what I would suggest is really look at the body tightness. If there's any asymmetry. Um, and to see if that maybe a pelvic was tilted, or maybe there was an old injury on the tailbone. If those can get resolved, if the age is permitted, for example. If like my mom, there are lots of things I couldn't do. She's 90. um, Lots of things I know how to do and how she could do it, but there's an age consideration, right? So if things have gone too you know too far, it's it's very, very difficult to reverse. So there's reality as well. Okay, so the bucket can be used, um, but we need to consider the reality and modify accordingly. Yeah. Thanks for the question. Okay, I got one more question. John, I'm also curious about when people are guarding emotions, they hunch forward. They would like to change but seem to become unaware easily. Is there any tips that you could think of? Okay, thank you. Thanks for the question. So essentially, when people have emotional guarding, their shoulders are hunched as if they're in fight and flight, which makes sense, right? They have something that they're guarding. And how do we resolve this? Um, so this is actually what we do in the clinic all the time. The clinic that we have resolve, or attempt to resolve PTSD and any emotional traumas, emotional issues. So what we do, so to fully explain this, that's basically the reason for this 7 talk. Okay. But to answer this question as, to a point, because I do like to answer this question, the first thing is about sense of purpose. Okay. All emotional things, essentially, there's a sense of injustice. There's a sense that this should not have happened. um, I don't deserve this. Why does this happen to me? Why are my parents my parents? Okay. Or why me being so nice and still being treated this way? You know. Um, so it's essentially a sense of injustice, or judgment, right? That what happened should not have happened. Um, so a sense of right and wrong. So I call this sympathy. Okay. So on the fourth session, two more days, I'll be talking about sympathy, empathy, compassion. So essentially, um, when we sympathize with ourselves, then we're a victim, and a victim has no power. Okay? Um, and no power. When we're a victim, we automatically assume a position of protecting ourselves. So that we're basically, when we try to protect ourselves, we kind of shrink. Okay, we try to protect our inside. Um, so that causes a lot of problems. So I would say the first thing is, really go back to our heart and say, I have a heart of gold that can never be broken. What's broken emotionally is my connection. And I see this over and over again, and this is what we use in the clinic. Okay. People with traumatic, severe trauma recover very quickly, not because we know how to fix hearts, and it's because we believe, in our core, that nobody's heart is broken. Okay. All hearts are heart of gold. What's broken is the connection, and connection can be remake, just with our choices. And right now, right at this point, we can choose to say, I have a heart of gold, and through loving kindness, I'm going to connect to my parents' heart of gold, and I'm going to love them unconditionally. Or I'm going to connect to my ex heart of gold, and I'm going to love that person unconditionally. It's our choice. And many people in the clinic ask me, it's like, John, why would I want to do this for that animal, for example? Okay, people who are sexually abused by their own father, for example. When I say this, it's like, okay, connect to your dad from your heart to go through loving kindness to your father's heart to go and just love him unconditionally. To certain people, it's like, John, how can you possibly ask me to do that for that person? I got a lady who she's in her 80s, almost jumped out of the bed and hit me in the face. She was raped by her own dad when she was about 12. I said, you're not doing this for your dad. You're doing this for yourself. And you're making a courageous choice to love your dad's heart of gold unconditionally. Your dad's behavior hurt you at that point, but you've been suffering because that was wrong. She couldn't do that for a long time, but she finally did it. She finally opened her heart, outrageously, courageously open up her heart, believe she has a heart of gold, and through loving kindness connect to her dad's, and repeated, Dad, I love you unconditionally for 60 seconds. And she was crying, she was sobbing, but at the end she was smiling and she was free. So this is how we resolve emotional issues or traumas in the clinic, by truly restoring our connections and truly exercise our choice, a choice that nobody can take away from. Essentially, when we have trauma, we feel like we're a victim. Our choices, we have no choice. Our choices were taken away from us, and our hearts were broken. So in the clinic, we have a different view, and we use that different view um, to resolve trauma. And to me, traumas are so important, so important to resolve. So that's kind of my answer. Yeah, thanks for that question. Very, very, very important question. Any other comments, questions? Um, so on the Clubhouse side, so if you're not a member yet, or if you like to, know, so today is the second day of the 7 Talk series, and I'm going to repeat this twice a month, um, until the end of this year. So it'll be 12 sessions, basically 12 7 Talk sessions until the end of this year. I'm sorry, not the end of this month. That'll be very difficult. Until the end of this year. So there will be 12 talks, 12 sessions until the end of this year for English. And I'll have the same in Chinese. And I'm going to alternate between 6 p.m. and 6 a.m. Pacific Standard Time. So if you'd like to hear more, if this somehow resonate with you, on the Clubhouse side, please click on my bio. And you can scroll all the way down, and you're going to see 4 icons that are the same. If you click on the third one, you'll be able to join the Mindfully Centered Club. Okay. If you can go through all the events and click on the bell, then you get notices, when they occur. Um, No more questions?
Hey, John. Actually, Phone Link posted a question in the Zoom chat.
In the Zoom chat, I've seen your deep squat. Okay, deep squat video on Instagram. Thank you for such a detailed video clip. What's the frequency you suggest for a newbie to start with? What sign to watch when it is enough or not done right? Thank you again. Okay. So deep squats are very interesting. Yesterday, my two nephews, my brother's two sons, were visiting, and I was showing them how to do this wall squats, and they were able to do it, but with a very tight and stiff back, okay, and arched back. So I would say the key for squatting, if you look at my Instagram and saw that video, the key for that is, first of all, uh, stay a bit farther away from the wall. Uh, and then the first thing is to notice the weight distribution along the 6 points. And then unlock the knee. That's really key. And then just pay attention to, and then, notice the bucket. Okay, make sure the bucket is there. And then just start to go down with the body weight going down behind the knees. Okay. And feel that the 6 points are unchanged. And the moment we feel the 6 points are changing, just stop and just gradually come back up. Okay. And notice any posture, maybe the head was, looking down, not eye levels, and maybe the shoulders are tight. Maybe the hip is tight, the pelvis is not flexible enough to, if you look at my Instagram video, my pelvis and my whole spine was actually moving when I squat down. So that's kind of what I would suggest is, just do the right things, and the moment we feel it's not quite right, just stop right there. Okay, so we do not reinforce any poor habits that we already have. So our body will continue to adjust. Yeah. And I would suggest that every time we do this, if we can do one, just do one. If you can do two, do two. But we got to do this with a sense of comfort. Okay. When we speak of channels, we don't want to get into fight and flight. We don't want to feel like, okay, I'm gonna do squats, I'm gonna go to battle. Okay, no, we want to be as easy, as carefree, as flexible, as elegant as we possibly can. We feel like, wow, this is, what a beautiful elevator that I'm going down and I'm going back up. And that's it. The moment we lose that feeling and we feel stressed, just stop. This is not about training our muscles. This is about, um, kind of realigning our body and readjusting our entire coordination and finding, good timing basically for our entire body to work with. So be patient and this will pay off. Yeah. Thanks for the question. Really good question. Oh, got one new message. I find it difficult to be elegant, at least for my first few tries. Uh, Shoot me a video and I'll show you the elegant side. Okay, I'll point out where what you did that was elegant to me. See, that's the thing, right? It's hard to pat ourselves on the back. Yeah, it's really difficult. But other people can see it. Other people, it's very easy for other people to say, you know, yeah, you do this really good. If you change that a little bit, then you're golden, right? Yeah. So we absolutely all have that ability. Okay. Okay, 7:27. 3 more minutes. I can take one last question. Anybody on Clubhouse side that is willing to ask me a question? No? Okay, alrighty. So today's recording will show up in my Google Drive, like yesterday's. So I recorded on Zoom, so it should include. I can stop